Okay, so here's our X-tip, and let's just open up the package so it's some Dentsply. And what you'll find in here is this is just for the perforator. It comes in a little package like this, and you open it up, and here we go. So you use this in a slow speed at 20,000 RPM, and one of the key things is that just to make sure, and you're gonna see Major Fernandez show this, is make sure that, you see how hard, you can't tell, but this is really hard to pull apart. So they should be separated. So just before you go to use it, make sure that you can get the perforator off, and so when you go to use it, it's easy to slide off.
So we're doing some smoothies here to release the pressure in the X-tip glide path. Okay, so let's pick a piece here. I got some attached gingiva, which is what I want to go into. And I do want to go parallel to the long axis of the tooth.
We want to make sure that when you take a look at the X-ray, the preoperative radiograph, that you have a sufficient intraradicular space between the teeth, because essentially that's what you're going for. So if this tooth, say for example, in this case, the tooth number 347 is a tooth in question that we can't get proper anesthesia with, the recommendation by the manufacturer is to go distal to the tooth, so it would be distal to the 47. But the problem is, my experience is that the buccal plate is so thick, along with the buccal shelf, that it's almost impossible to perforate through the cortical plate and get into that cancellous bone. So what I do, and this is, I've had great success with this, is to go mesial to that tooth. And then if I'm going to go mesial, I'm going to make sure that, yes, there's sufficient intraradicular bone to make sure I'm perforating into cancellous bone. Now, if you hit a root, you're going to know you're going to hit a root because it won't progress. The root is significantly, a tooth root is significantly more dense and tough, more difficult to perforate than cancellous bone. So in that case, we remove the perforator and start with a new one and place it in a different location. Don't quit, because the patient still needs to be treated.
Take a dimple, I find my location, I mark it, and I take this. Go in. So now this part here, it can be really hard. That's why you do the loosies-goosies to loosen it. But what we'll do is, we'll take some pliers here, hold on to that, and you don't want to put too much pressure, okay? Because you could break that. So you get that out, see, and look at it, and make sure it's the one piece, because I show you that X-ray where they have a broken tip. So if we're into cancellous bone, it should flow. If it resists, stop and change your location. The moment of truth, I think better word. Ready? Bam.
My heart's starting to race.
You see right there? You see right there? Oh, I forgot to warn the patient that he's gonna have his heartbeat's gonna go up for 4 minutes.